It is estimated around 1 million Americans live in Mexico, and the majority are over 65 years old. Over the past 20 years, one man has studied the possibility of Medicare coverage for retirees living in Mexico.
Last year, what we decided to do was to look at the roughly 500,000 people born in Mexico who live in the United States who have Medicare, to see kind of what the probability would be that they might retire to Mexico or even need coverage when visiting relatives in Mexico. We identified about 10 congressional districts in the U.S. where people born in Mexico account for 15 to 30% of everybody in the district, and where there are 10 to 15 to 20,000 Mexicans over the age of 65. And since in 1986, everybody who was in the country more or less was legalized, almost everybody who's over 65 in the U.S. from abroad is also a U.S. citizen or at least a permanent resident.
For financial reasons, many Americans retire in Mexico, and Warner believes government-sponsored health care coverage should look at adapting to meet the needs of its beneficiaries.
Most people end up going back to the States when they get really sick to be near a relative or just to have Medicare. This would be a way, if they wanted to, for them to stay in Mexico, and it would be a lot less expensive in their declining years. And if that was their preference, I think it would work out well for everyone.
It will take an act of Congress to establish Medicare benefits in Mexico. In Part 3, I look at one man's crusade to make this happen.